So today we're thrilled to introduce you to a remarkable figure in the field of psychology, Dr. Ismahan Soukeyna Diop. Hailing from the prestigious Université Cheikh Anta Diop in Senegal, Dr. Diop is not only a psychologist and psychotherapist, but also a mentor shaping the future of psychology in her country. Her groundbreaking work in African mythology and storytelling has led to the creation of TAMPSY, a revolutionary psychotherapeutic tool. This tool, rooted in a decolonial approach, is transforming mental health care in Africa. It's currently being implemented in Dakar's Fan Psychiatric Hospital, where social workers and medical practitioners are being trained to enhance mental health care and combat stigmatization. She's also the author of several books on African mythology, femininity, and maternity, which we'll talk a little bit about throughout the episode. But we're really thrilled to have you here, Ismahan. Thank you for joining us on the Global Health Unfiltered podcast.
Thank you. Thank you for having me.
So I guess the place where I would like to start is to really understand what motivated you to first get into the field of psychology and mental health therapy, and then talk about your novel approach to mental health care in Senegal.
Thank you for this question. So I am from different African countries, and I grew up in Senegal, in West Africa. So I was always interested in culture and mental health, in psychology and psychotherapy. So when I graduated from high school, I went to France to study in a university, and I studied from the first year to the fifth year, and then I went back to Senegal to start working as a clinical psychologist, because my degree was a master's in psychology that allows you to work as a clinical psychologist in Senegal. So when I started to work, I felt like many things that I have learned at university were not really culturally relevant in the field where I was working in Senegal. So I had to adapt my knowledge to what I was doing and the people I was working with. So I had to gain more knowledge on different other topics, for example, to know more about listening, about culture, about traditional healing, to understand what people were talking about during the sessions, to try to find a way to connect with people and build a stronger alliance with the patients. So I was working with children at the beginning of my practice, and I found that storytelling was a powerful tool, and I found that it was very interesting, and it was inviting to the conversation, and it was a way to get connected with people, to get a way of work together. And I started using books for started children books of tales for children, and then I was captivated by the symbolism of those stories, what they meant, how it reflected certain aspects of society, of mythology. And since I was working in the context of womanhood, femininity, motherhood, I felt like many of the books I was reading and working in storytelling were actually comparing the characters of femininity in different ways. For example, the character of the devouring mother, the witch, the sorcerer, the kind person, the old woman. And I found so much to explain, to explore in terms of symbolism, that I explored this aspect in my thesis, because then when I was working in Senegal for a year and a half, I decided to do a PhD. So I contacted my university in France, and I started my PhD going back and forth from Senegal to France. And I was exploring the consequences of hysterectomy and breast mastectomy on the women's status in Senegal. So I was very much interested to explore the women's status in African societies, what these surgical intervention meant for them in terms of representations of their bodies, narcissism, ideas of themselves as women and what was the image of women in the society. And I was interested to understand how this image was conveyed in mythology and storytelling. So this is how I started to explore the symbolic aspect of those myths and tales and try to make ways to understand how it was reflected in those books and how patients, when they were looking at them, they were giving their symbolic representations, what it meant for them, what it says of their lives, their echoes, their representations. And then this is where it came from to start making TAMPSY, because I was feeling like we need a tool to be able to captivate people's insights and to be able to make a connection in the clinical psychotherapy. So I explored those myths, I analyzed some of them, I explored those tales, and I made storytelling cards out of those tales. So this is where TAMPSY comes from.
And I love the fact that you actually discovered that storytelling was one of the ways you could get through to your patients. I was smiling a lot when you said when you were working with children, because that's my field, and I'm very excited when storytelling is able to lead you to something. Because and I like the fact that you actually applied everything that you learned culturally to make it culturally appropriate for your patients. Um, given all of that, and I think we'll talk about TAMSI a little bit later, but you have mentioned it. What would you say are the major differences between the way mental health region, like in the West, and how you see it being practiced on the continent? Like, what are the major differences that you have picked up so far?
I have never worked in the West. I've only worked in Africa. So I work as a clinical psychologist and I teach at Ismahan Diop University. So I've never had, apart from my training during my clinical education in psychology, I never had a clinical practice in Europe or United States or North America in general. So I cannot say that I can notice some differences with patients from there because I never worked in these places. I've only worked in my country and other African country. I've been working in Guinea and Djibouti and Senegal. So these are the places that I know to be able to compare within. But what I can say about integrating knowledge, because I want to not my knowledge that I learned from my university in all of the curriculum. It's not that it was not relevant. It was that it was insufficient. So I have learned a lot from it. I just needed to enhance it and to make it better to be able to work here. But it was relevant to me to understand, to be able to have a critical point of view. You have to know both sides and then be critical. So that's what I can say about my training and my practice and the education I gained. But throughout my doctoral training, I was being educated in both France and my university where I work right now. So I had both training at the same time, because since I was at Dakar Cheikh Anta Diop University, I was attending to their courses, and then I went to France to attend to some of the courses because I was going to France twice, for example, for a month in a year, for 3 years. So most of my time was here. Most of my courses were here. So I've been able to gain education in other courses that I would never have access to if I was there. So it was a complementary education with knowledge that I would never have had access to if I was only in France. And I wouldn't have had it from a perspective of someone in my country, with a training from a teacher from my country. So that's a completely different point of view and perspective. What I can say in terms of comparison is that what's interesting about mythology and storytelling is that there is a huge part of storytelling and mythology that's actually human, and that is expressed differently if you take a perspective from a different place. And analyzing mythology has brought me to analyze how society builds ways to understand the world depending on their options, of their interests, of how they want things to move in their perspective and in their interest. So comparing myths from different places in Africa was interesting to be connected to history, to colonization, to how people perceive the connections with society, with many issues, for example, climate, many issues, for example, social recognition of status, of economic domination, of emancipation. This is very interesting to be able to just take some information from the mythology and just expand it to understand the whole geography of human beings and how they think and how they spread in different places, how they migrate from one place to another. So this comparison, I was able to make it working with other researchers from, when you say the West, also from the Caribbean and also from South America, and particularly from Afro-descendant communities in North America.
So my question is, if I can simplify that, it is in the work that you've been doing, trying to use the myths and the stories that Africans for the longest time, for generations, have used to understand our circumstances. How has that been perceived? Because it seems as though other mythologies from like the West are easily adopted into modern psychology. But do you find that there's maybe a colonial resistance to some of the work that and the approach that you're taking?
Oh, I wouldn't say that there is a resistance in front of the word that I am doing, because there is more and more work on decolonization. There are collections of books. There is a real demand in terms of knowledge, in terms of decolonization. There are seminars, colloquium. I mean, it's a real topic it has been in the last 10 years. And it's really something that's dominating all the sphere of education at the moment. What I think is that there is more perspective and work to be done in methodology. Methodology for many things, because theorization comes from methodology, and the way we theorize has something to do with the way we observe, with where we put ourselves in terms of research. For example, when we think about topics like Oedipus, Oedipian or Oedipus, I'm not sure the word in English because I've said it many times, and I've never been sure if it's Oedipus or Oedipus complex. So Freud, he took this example and he built it, and he developed his theory with what he had. And Freud was a psychoanalyst who never worked with children. He never worked with children. He was seeing adult patients. But he only was connected to that child, Hans, whom was the source of this Oedipus complex, through his father. So he was speaking with his father, and his father was speaking with his child, and he was reporting to Freud, and Freud made a theory out of it. So everything in the theory, in the Freudian psychoanalysis, is something that he designed thinking about children but not speaking with them. And he was seeing adult patients, and he was speaking with them and guessing how it was for them when they were children. So in terms of methodology, it's a different perspective than what people do now, because right now in 2024, I mean, if you're a researcher and you're saying I have a theory about how it works out when we were children, and I've been working with adults, like 20 of them. So I guess that it was like that before. Like, it wouldn't be consistent right now, right? But back then it was. And he made a theory out of it. They explained many things, and many things happened, and psychoanalysis was born. So they had to find a way to make it consistent, and they had to make it consistent. They had to find an explanation in their mythology, and they found something in the Greek mythology that was not theirs, but it was Greek mythology, which is always, still different than their mythology, but still they used that one. So what I think is that if you take the concept and you say, okay, so Freud said this, and he said it in that specific context, and then I am in Senegal and I'm observing this family, and I want to use that theory to say what they're doing and how they're doing, and if they're not doing like Fred said, then there's a problem with them. That's not consistent, that's not professional, that's certainly not helpful. So maybe if you want to understand and make science relevant for the people who are using it, for example, the people who are seeking psychological support and coming to you, they want to have something sorted out. They want to be helped with something because they came to psychologists to find a solution to it. Maybe there are other ways to just get all of this frame of understanding and find ways in your head to host the new material. There was a very, very important scientist his name was Claude Lévi-Strauss. He was French. And he said that every culture had a structure. And if you want to understand a culture, you need to get to the structure. It doesn't have to be exactly the same, but there has to be a structure. It's like every language, because every language has a structure. There is something that says an action. There is something that says the object that's being connected to the action. There is something else that says who is doing the action. And if you get to understand those three parts, then you can adapt yourself to get to the language and learn the language. So there are no simple languages and complicated languages. There are only people who can learn. So he took this theory and he adapted it to culture. And he said, if you cannot get out of your own culture to understand someone else's culture, it means that you're centralized on your own culture and you cannot have access to someone else's. And he said that there is something to be called cultural relativism, that we have to be able to distantiate ourselves from something we know to get to another point, to host something else that's not ours, and understand it and adapt it and get to the structure to get to the problem. So if you're a psychologist and you're working in an environment that's not your culture, you will say, okay, so in this country, this person has this strong dynamic, so he's supposed or she's supposed to be the person taking the decisions. So this person is the person who is impacted by the decisions. So that's maybe the way they're doing. So if you think about mythology, you'll try to find ways to understand how this person was raised, or were they using oral tradition, conveying messages from cultural context, and then you will try to understand those messages and to get to this literature that was told to the person, because it's always a question of what information is there outside where you are that you can use to understand where you are, how it works. And that's how mythology helps to understand how the field works, how the people are interested, not interested to you or to a situation. So mythology is a body of knowledge that if you want to know a culture or a situation or people, the best way to get closer to their explanation for something that happens is to get closer to their culture, and mythology is the culture.
Now, we're going to the big thing. I mean, TAMPSY Otwa, is that how it's pronounced?
It's TAMPSY, Tales in African Mythology Psychotherapy.
Right. Okay. Could you tell us a little bit about it? Like, what is it? Maybe someone is hearing it for the first time. What how would you describe this?
Okay, so TAMPSY is a tool that's used in psychoeducation and psychotherapy. So there are 3 stories in TAMPSY. For example, 3 tales, 3 story tales, and these are sorry, I think there's a bit on my end. And these, they are divided in cards, like cards with images on the one side and text on the other side. And these are, for example, if you can imagine a book with 10 pages, each image is a page of that same book, and there are 3 books. So each page is a picture, and the person can see the picture, and then they say what they think about the picture, how they can guess what is inside, and how they can be enticed to make links with what they know about their own lives or people they think about when they see the pictures, and then they can read the text and the story goes on. But then at the end of the 10 pages, we can discuss about all the images, about the tale. How do you feel about this story? If you had to choose to pick a character, which one would it be for you? Which one do you think is the most resemblant to you? And how do you feel about this character, what he did? And the people seeing the story and reading the situation and speaking about the story can make links with their own lives. For example, I feel like this reminds me of some situation I've been through and the way I reacted to it. And maybe these stories are extracted from African storytelling. So I picked different stories from African tales, but from different countries. So one of them is from the Fulani culture. The other one is from Benin, Central Africa, West Africa, more to the center than than us, West Africa. Senegal, Ivory Coast. Benin is closer to Nigeria, which is still West Africa, but farther on the east side. And another one is from East Africa, Ethiopia, and Djibouti. So I picked those tales, those 3 ones, because in the analysis that I conducted in my book, I felt like they were inviting to a lot of symbolism and reflection about people, about how they felt from their perspective in different places, about parenthood, about femininity, about sexuality, about social responsibilities. And I felt like these stories were inviting the conversation to so many important topics that you would not necessarily have access to in a classic clinical psychotherapy right away. So you would have to get into the topics to start talking about this. But when you use the cards, then the people already invited and they choose if they want to get into the topic or not. And usually they're invited to just address the topic. And since it's coated in African oral tradition, it's more like a projective space where they can make an alliance, because the psychotherapy and the psychology is still very alienated in terms of a science, specifically European theories, specifically European way of doing psychology, of experiencing psychology, of connecting with people. For example, the fact that the psychotherapist is far on his side of the desk and he's talking to the person, he's half responding or just listening. That's not a natural conversation that we would have in African countries. Usually people would face each other and they would nod if someone says something, and they would rebound on the communication or the conversation, or they would share something. So the classic psychotherapy setting that's very European doesn't really invite to an alliance. And if there is no alliance, the counter-transfer mechanism that helps the therapy can be missed in the interaction. So making something interactive that's actually inviting to reproduce the traditional, the oral tradition process that people already have in their culture is more inviting to an alliance, but at the same time, it's a free space. So you see the image and you can discuss if you want to get into it or not. You see the image and you can feel that that's something familiar, but it's different, but it's something that invites you to say something about it, or you can make a link with the movie. And then we can also get into the free association movement of psychoanalysis. So you say something and then it brings you to another topic and then it jumps from this one to another one. So the connections are easily made when it's possible for people to be free and just speak freely about something.
That's fascinating. And as you're talking, the traditional picture of a psychologist sitting on an armchair, and then the patient lying down on the couch comes to mind. But that's a very European Western picture in mind, and what you're changing is this picture, right? It's not. It's you're changing the way we picture psychology happening in ways that are more interactive, ways that reflects the way a lot of African cultures communicate and engage with each other. I'm curious if you can take us through what that process looks like. So if a patient comes to you and says, for example, that I feel like I'm seeing things or I'm experiencing things and I'm really worried about it. I'm worried what I would do. What would the process look like? You mentioned 3 stories. How do you even go about figuring out which story would be relevant to that particular case?
As a practitioner, people choose which patient and which story they will use. So they know that there is some of the topics, because each story has a few topics that are targeted in the story, because it's because of the topic of the story, the main character, the situation, the place. Each of the stories are targeting specific aspects of society, of problems that people may have. So you choose which one you think is relevant for the story. And then when you choose that, just open the floor for the person to navigate the story at their will and to find and pick one of the topics. Because they will say, you will ask which one of the cards you would like to choose as the one that struck you the most. And then the person will just pick the card that they want to just talk about, or they will avoid the card they don't want to talk about. And you also have to respect that, because people can choose if it's the right moment. But whatever happens, even if they avoid talking about a card at this specific moment, maybe in the next session or the next session, we'll bring up the topic and say, hey, I dreamt about this thing because it was still in my head about the card I saw this day, and this story, it reminded me of this thing. So the free association process will work because people have seen things that stayed in their minds. But the fact that people choose to talk about things, it's always something that's opening the conversation on a specific topic that's not being suggested in the regular conversation.
Right. And I was just wondering, like and this means you had to read a lot of African myth, like you had to go through all of this to choose the stories, like with the collection of stories you have currently, like what drove you to choose that group of stories where you can pick your 3 stories from for each patient.
My first book was about African mythology, femininity, and modernity. So I explored the African mythology for 3 and more years to read everything that was in the storytelling literature, classic, not classic, from other countries, from Senegal, from West Africa at large, from Europe also. And I explored mythology to just make connection between among tales. So I divided those in groups of tales, because there are tales that are in the same group, because they're, for example, the same idea can be represented in different stories, in different countries, different people. And it's a type of story. So you don't have, I would not make a TAMPSY out of the same story divided in 3 countries. I would take one of them, try to connect in the same group of story, and then use another topic and look for another story that targets a different topic. So I did read and explore many, many, many tales before picking the ones that were most inviting symbolically in terms of accessibility and interest with people.
One of the tales that I remember reading about when I was researching your work was the tale of Mami Wata, which growing up in Cameroon we heard a lot about, and I believe it's probably extends to Nigeria and other parts of Western Africa as well. Could you?
Culture, yeah.
Yeah, would you mind telling us a little bit about what you discovered, or maybe even the tale, because this is something that we heard about growing up, and it was kind of seen as, let's not talk about that. Let's, it's mystical, right? So I'm wondering if you could tell us a little bit about specifically the Mami Wata mystical story.
Okay, so Mami Wata is more a mythological figure than just a tale. She is there is a story, but she's a mythological figure that's representing the devouring mother, the seductor woman, and she's connected to the water. Mami Wata means water is for water. She's supposed to be a mermaid, or in some countries she lives near the water, but we don't. It can be different depending of if the country has the beach or if it has another type of water place. And she represents, in the same ways, mermaids represent the seductive woman, attracting men into into ambush and taking them without, them knowing that they were being ambushed. That's a very, very important topic in humanity at large. Like, in every country, mermaid is associated to calling men into doing things they don't want to do, or they want to do, but because they don't know what they're doing, or being seduced and killed tragically, because they represent the fear humanity has against women and against nature at large. Because in every story, women are connected to nature because they give life. So nature gives life, so women give life to make the connection. Women are nature. Because they're not to be controlled, because they're associated to the lack of control, lack of predictability. For example, the adjective lunatic is connected to the moon. Women also are connected to the moon because of their cycle, because of their unpreciseness. The sun is always the sun, but never, the moon changes shape, changes form, depending on the month. So in this idea of women being unpredictable, society has given that idea that's completely constructed and actually very socially driven, that women are uncontrollable and have to be controlled. There is a fear about women's domination that's expressed in this relationship all humanity has towards the devouring mother. And this idea of Mami Wata being attractive and sexually attractive to men is also neglecting the capacity men have to control themselves, because they are being attracted and they are being lured, but they don't know what they're doing because she's a sorcerer, so she can take advantage of them. So that also translates this idea that women are evil. So if something happens to them, maybe it's their fault. So this idea is the grassroots for also many other representations of women as being at fault in many situations. And it's also the soil for gender-based violence, for women abuse, for many things that are ways to accept fatality against women, because they have this side of them that's attractive, and men cannot respect this idea that in social representation, it's actually this also countering the feminism and the feminist representation of Mami Wata, because if she is a woman, she's wealthy, she's beautiful, and she's attractive, she's supposed to be a good character, right? She's supposed to be successful. But no, she's evil, because people want to be with her, and they will lose everything they have being with her. So there is also this rejection of emancipation in women, as in the idea that emancipated women characters in storytelling are always the bad characters. The witch is always wealthy. She always has power and money, but she's the witch. So there is this idea of being submissive and being good, connected. Being authoritarian is not good. So tales in tradition have the idea to educate and shape people into making the world work the way people want it to work. So they have this idea of sending a message that's supposed to be protective of specific frames of understanding, of specific situations that have to be maintained in a specific order. If you take, for example, storytelling that I've analyzed in the character of the devouring mother, every story where there is domination by women starts with a chaos. So there is something very wrong in the fact that a woman is at the top of hierarchy. But when the prince or the character that's supposed to be helpful and save humanity comes, then he restores the order. This means that the order has to be the one that comes next, but the chaos is first. But it brings the other idea that in a specific psychoanalytical theory that was created by an other very brilliant psychoanalyst whose name was Melanie Klein, and she was the main psychoanalyst that came and started to work after Sigmund Freud, and she brought a completely different perspective. First, she was a woman, so she had another way of seeing things. And secondly, she said, okay, so Freud said this about children. Well, I'm going to see children and I'm going to play with them to see how they are feeling and what I see from them. And then she started her work like that, and she started her theories really centered on this perspective. How do children feel, and how do they express their inner fears, and how do they show what's inside of them? And then she adapted a therapy technique, so because she felt like the psychoanalysis and the way Freud was working was not effective with children, so she had to find ways to connect with them. So she used games. She was working with games. She played with those kids, and she was observing them playing. And what she found was that what Freud called the phallus, I'm not sure how we say it in English, the phallus or the phallus.
Yeah,
So
phallus, yeah.
Freud naturally thought that phallus has to be masculine because he's a man and he sees that the power is on man's side. So he says that the phallus is masculine. So whatever happens, people want to get to that level because being a man is being on the top of hierarchy. So the phallus is masculine. So if someone gets out of the Oedipus complex, they just want to get to the male side. Either they want to be next to a man or they want to be a man, but it always has something to do with a man. So Melanie Klein, what she says is that actually that's weird, because whatever the sex of the child is, they're always coming to life through a mother. So it's not like if the child is a boy, he's being fed by the father, and if it's a girl, she's being fed by the mother. The mother is always feeding both kids, whatever they are. So there is no connection connected to the child's sex, gender. So the child comes out of, a mother's womb, and the first interactions are very structuring for their construction of their psychic system. And at this specific moment, whatever the child's gender is, the domination and the phallus is the mother. So the phallus is feminine at first. And then when society makes its work, when the child is being exposed to the rest of society, then there is this idea of the phallus being exported from the mother's side to the outside, because there is another entity that's hierarchy, that's social order, that's expressing a pressure on the mother, making her socialize the child through the education process. But this movement of being connected to a woman who is completely powerful has stayed in humanity in the form of this fear of womanhood as an uncontrollable, powerful thing that people do not have the power over. And this is what transpires through every myth, every tale, every representation of the devouring mother as the figure, the feminine figure that the society is afraid of. And this is why this figure is everywhere, because everyone has had this feeling of being completely powerless compared to an entity that was feminine, that was completely powerful. So this representation of how society has shaped in the global unconscious this fear of womanhood is actually really rooted in some of the concept of psychoanalysis. And that explains these many mythological feminine figures in every tales, in every place where you go.
Wow. I mean, you've broken that down for us. And at this point, I really want to be Mami Wata. Desmond Wata, okay? All the stories you heard about Mami Wata, I think I want to be that powerful woman. And I'm happy that you're able to reach out to women in this field, because you said your work focuses on women and children mostly. But I also know, or maybe I'm wrong, that mental health, like owning up to the fact that you need help in our culture, is something that people shy away from. And so, how is access like? How many people come to you for psychotherapy? How are you able to practice your clinical psychology as you would? Do you think you see a good enough number of patients in your setting? And
Oh,
how do people receive this?
I don't have enough time to see every patient I would that would need psychological support, but the project of training psychologists in a university is part of the plan to expand and just distribute the psychological support and access to everybody in every place, because many people come from I live in a capital city, so many people come from their cities to seek psychological help at the capital city, because they're not, all of the psychologists, almost all of the psychologists are in the capital city. Some of them, a few of them are in other cities, but not every place. So training psychologists in a large university is also yielding that project to just expand them in various places for people to be able to have access to it. And it will also make these psychologists work in social structures and large public hospital structures. So people will be able to have access to them everywhere they go. For example, in a youth house, in the classic psychiatric hospital, in a place where they would get social support. So these people would be exposed to this help. I mean, would have access to this help. Being in a private center makes me more of a researcher than a psychotherapist if I have to think about the number of people that I'm seeing compared to the number of people who have a need for psychological support.
Yeah, there's certainly a lot of work to be done in terms of training enough psychologists, therapists to handle the burden of mental health, across the continent. Would you mind telling us a little bit about the impact that TAMPSY has already had on your patients and on the patients of the psychologists that you've trained so far?
Well, I think it's too soon to say, to evaluate the impact. I mean, it's soon, maybe not too soon, but it's still soon to say, because patients who are in their therapy using TAMPSY are still in therapy. So I haven't had the back words to say how it has helped them in their lives after the psychotherapy. What I can say is TAMPSY is empowering for a therapist. Why? Because as African practitioners, and not only African practitioners, practitioners from the diaspora and from indigenous cultures at large, because I have been coordinating a toolkit on indigenous psychology with other colleagues from many countries, from India, from Nepal, from North America, in American Indians, from Brazil. And we have coordinated a toolkit on indigenous psychology to understand how we can take things from our cultures and make it powerful tools for our psychology in research, in training, and in practice. So we have been working in how to value our own cultures in the understanding of what's happening in the clinical interaction, in research interaction, and how to make it relevant for us as professionals. And all of us have come to this realization that when we are trained to do our work in Western theories, there always has to be a switch between what we learn on one side and what we are on the other side. So whatever people say about their cultural things, we have to say, okay, shut this down, and we have to understand it the Virgin way. So what does Freud thinks about this? So, or not Freud, but the European theory, what does it say? How do I respond to this in my psychological costume, and how do I respond to this in my human costume? So using TAMPSY is empowering in the fact that it takes out this wall that we build in our own identity as professionals. So for example, if someone comes and says, okay, this tale makes me think about spirits that my sister had when she was a child, and it was this. We don't have to think about whatever is right, whatever is wrong. It's a tale, it's a story. So just navigate the imaginary, navigate what the people say and how they feel about it. Don't start thinking about what's real and what's not real. And it takes out this stigma that we have to work accordingly to what is real and not real. Even if our culture says that those boundaries do not exist. So as professionals, we have the possibility to just take a stand out of the story and just watch the imagination makes it work, watch the symbolism makes it work, and navigate these representations. So that's what I learned from my work with other people from other countries in other representations that do struggle with the learning they have from the university in their theories, and how they know the culture from their countries, and it gives them analysis. That analysis and symbolism can actually make sense to their understanding of what people say, to their understanding of life as it's actually lived in where they are. And this connection is very helpful when you're a professional, because it centers you to the idea that, what do I fear about what this person said? And how do I interrogate this fear? Because this fear is the key to the analysis. How do I understand this fear, and how do I explore it? And what do I share with this person, and how do I work with this? Because that's where the alliance is.
I'll move on to your book. You did publish a book on adornment, masquerade, and African femininity. Can you tell us, just highlight it and tease us a little bit so that our listeners would go grab the book? Because I love the idea of African femininity.
Okay, so I already said a lot about it without addressing it properly. My work on African mythology had this dimension on representing how adornment was playing that key role into demonstrating women's body, into demonstrating this ramification of identity that we show in the way we appear in social life, in rituals, in society, and how adornment is very representative of status as well as social recognition. So, in this book about masquerade and African femininity, I was very much interested to explore how these women have been working with after mastectomy, how they were reconstructing their identities as women, how social representation of women was very much an issue for them, for their own idea and narcissism about how they felt in their skin, in their identity. So in this book, I address many topics about not only identity, but also narcissism and the image, the body image. So I address topics, for example, like colorism, and how the idea of Black women are always a target of their social representation of colonization and coloniality, because this idea of colorism and skin lightening, for example, is always this conception of being lighter is being better. So this is a ramification of coloniality that's still very present in how women are represented in society. So if they want to get a better status, they have to be better, and they have to be chosen. So to be chosen, they have to be better. So there is this competition about how they can make their body look different to get better. So there is this connection with the human body, the women's body, that's very present in people's representation of social life, of how we appear in society, how we appear in people's minds, and how we can manipulate this image. There is this other idea in education that women have to be pleasant, have to be slower, have to be nice. And I speak about the masquerade because the masquerade is a Lacanian term in Lacanian psychoanalysis. It means that in the representation of womanhood, this idea of fragility, of delicacy, is constructive to what female's beauty is. So beauty in a woman is always and also connected to fragility, because it's supposed to be nice and nicer to this representation. So in this field, when I wrote about this book, I also pointed out the idea of appearing socially as inviting and has need for completion is also a part of women's education. This is why the character and storytelling of the woman who is good is also the one of the woman who is in need, because she has to be in need of something. The other woman who is bad doesn't need anything. She has everything. She has all the power. So there is this dissociation of women's status that's actually very present in storytelling and in social representation and education. So that's what I talk about in this book.
I have so many other questions, but I've learned so much from you.
Thank you.
It's almost as though it's a bit of a therapy session for me as well, because I'm remembering a lot of conceptions about, specifically Mami Wata figure.
I know, like we are all having some free therapy right now. So thank you.
Yeah, there was a song that we used to sing. If Nami chop this rice, if Nami chop this rice, Mami
May
Wata go
mommy water
swallow
carry
me.
me. May mommy
Yeah.
water.
So it's very interesting, and again, the Mami Wata figure talks about the way women are perceived in society, but also has implications for it. Says a lot about men themselves, and so I just want to thank you for coming on the show, and thank you for the work that you're doing. There's much need for not just mental health care on the continent, but mental health care that is contextualized, that is specific, that is relevant, that is cultural to Africans, and reflects the realities that we see around us. So congratulations on launching TAMPSY. We're going to share a link to the TAMPSY website for those who are interested in learning more about the work that you're doing and supporting the work that you're doing. But we're also going to share the links to your books so that people can check out to learn a little bit more about the what you've written about. Thank you, Ismahan, so much for coming on the show, and thank you to you, our listeners, for tuning in. It's been a pleasure. So to learn more about the podcast, the blogs that we're doing, you can go to globalhealthunfiltered.com. We also appreciate your support. So if you enjoyed hearing from Ismahan, feel free to subscribe, give us a 5-star rating, because this goes a long way to support the work that we're doing to bring amazing guests like Ismahan on the podcast and on the show. And if you'd like to contribute, you can support us through our Patreon website, or you can make a one-time donation through PayPal. Again, that information is on globalhealthunfiltered.com. Thank you very much for listening, and see you next time.